nausea, vomiting, diarrhea, overuse of NG, suctioning. The signs and symptoms of that are going to be muscle weakness, and it's going to look like flattened waves on an ECG, and constipation, and also like arrhythmias. So nursing interventions, so you're going to put them on a cardiac monitor. You're going to administer either oral or IV potassium. Typically, if the potassium is above 3.0, like if it's 3.0 to 3.5, it's usually oral, but if it's below 3.0, it's usually IV, but it depends on what facility you're at and the protocol for that. And you never push IV potassium as well. And you're gonna educate on the patient on eating like higher foods with higher potassium and monitor their labs closely. Next one is going to be calcium and magnesium. So let's start with calcium. So the normal range of calcium is 8.5 to 10.5, and the function of calcium is for bone health, muscle contraction, nerve transmission, and it also helps with blood clotting. So hyperkalemia is going to be above 10.5 milligrams per deciliter. So causes are hyperparathyroidism, cancer, and overuse of like thiazide diuretics as well. So signs and symptoms, so you're going to think lethargy, and you're going to look at their reflexes as well. So they're going to have decreased reflexes, constipation, and also kidney stones. So nursing interventions, so encourage fluids, and you can diurese them as well, and you can also give calcitonin to lower the calcium, and you also want to be monitoring their kidney function as well. So hypokalemia would be a level below 8.5 milligrams per deciliter, and the causes for that are hypoparathyroidism, a vitamin D deficiency, and also renal failure. So the signs and symptoms, so they're going to have a positive Chavatsky and Trousseau sign. So when you tap on their cheek, their facial muscle is going to twitch a little bit. And then a positive Trousseau sign would be if you inflate a BP cuff, their hand is going to go like this. So the interventions for that, so you can give oral or IV calcium. You are also going to monitor for seizures, monitor their airway because they can have laryngospasm, and you also want to monitor their vitamin D as well, and encourage vitamin D because if they're low in calcium, they're probably going to be low in vitamin D. So you could do supplements or just encourage foods with high vitamin D. Next one is magnesium. So normal range for magnesium is 1.6 to 2.6 milliequivalents per liter. Function of magnesium is to support muscle and nerve function, cardiac rhythm, and your cardiac rhythm. So hypermagnesium is going to be caused from renal failure and excessive use of like antacids or laxatives. So signs and symptoms can be low blood pressure, decreased reflexes, bradycardia, and respiratory depression. So nursing interventions would be to hold any magnesium containing medications. You can administer calcium gluconate. It's the antidote to hypermagnesium. You can also monitor their reflexes and their respiratory status. And they may or may not need dialysis depending on how severe it is. So for hypomagnesium, which is a level below 1.6, causes can be alcohol use, diarrhea, overuse of diuretics. Signs and symptoms, biggest thing you want to make sure is that you want to put them, the signs and symptoms are like tremors, seizures, and increased reflexes and arrhythmias. So you want to put them on You want to put them on seizure precautions, and also encourage magnesium rich foods, and also administer oral or IV magnesium. All right, and that's it.